Hello and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. Many countries are showing more interest and progress in scaling up infection prevention and control, or IPC strategies, which include hand hygiene. But overall, the progress is slow and gains are threatened. According to the Clinical Microbiology and Infection website, in 2021, only 4 out of 106 countries had all minimum requirements for IPC in place at the national level. In several surveys conducted by the World Health Organization, training and education were the weakest components of IPC programs around the world, both at the national and facility level. Healthcare-associated infections, or HAIs, are some of the most common adverse events that occur in the context of healthcare delivery. We concentrate on hand hygiene today. My guest on the program is the National Program Coordinator, Infection Prevention and Control at the Nigeria Center for Disease Control and Prevention, NDDC. That's Dr. Tochi Okwo. She joins us from our Abuja studio. You're welcome to the show, Dr. Tochi.
Thank you, Mary.
I just want to clear this up. Is there more to hand hygiene than washing of hands? Are there other components included in hand hygiene?
Yes, there's definitely more to hand hygiene. While washing your hand with soap and water is one of the ways we do hand hygiene, there are other aspects. There's also what we call the alcohol-based hand rub, where you use the alcohol-based hand rub to make the hand safe in the provision of healthcare.
Okay, what are the most crucial times for hand hygiene? When must hands be cleaned or washed compulsorily?
Yes. Before I answer that, Mary, I would like to provide, just in a minute, the reason really why in healthcare it's important that the health worker makes the hands safe. You know, people go to the hospital or anywhere where they get healthcare expecting to have good quality care, expecting that they will get better and they will not leave the hospital with an infection they didn't have before they got to the hospital.
That's right.
So there are critical moments where the health worker is interacting with the patient as he offers the health care in that space, where a health worker must be diligent and pay attention to making the hands safe. And 5 critical moments, which we call the 5 moments for health for hand hygiene, have been identified as those moments where the health worker must do hand hygiene, whether that moment calls for hand hygiene using soap and water, or that moment calls for doing hand hygiene using alcohol-based hand rub. The health worker must then pay attention, following the given steps, and also even paying attention to the timing in doing those moments. And those moments really are what we make sure we teach every health worker before the health worker does what we call a clean or aseptic procedure, when a health worker thinks that the hands have encountered body fluids, or when before a health worker even touches a patient, or after a health worker has touched patient care environment. So there are 5 critical moments, and that is what we focus on each time we teach health workers how to do hand hygiene. We also focus on the timing, because the timing when a health worker is doing hand hygiene using soap and water is slightly different from the timing that is required when a health worker is using an alcohol-based hand rub.
Okay, what then is the place of the glove?
The place of the glove, it's, you know, we talk about preventing healthcare-associated infection, as I've mentioned before, and the whole evidence-based practice that helps us to do that is the infection prevention and control practices. So when we talk about infection prevention and control, there's one very important aspect of it. That is what we call the standard precautions. And standard precautions are those things a health worker must do anytime is interacting with a patient in healthcare, whether that health worker knows what infection the patient has or not. It is the standard of care. And within that bundle or package of things that a health worker must do, hand hygiene is there. Then understanding when to use glove as a personal protective equipment is also a part of it. So glove is a component of personal protective equipment, but the using of gloves does not remove the need for doing hand hygiene. In fact, the using of a glove means that the health worker has done what we call a risk assessment, and therefore has now said in my mind, my hands are going to encounter body fluids of this patient, meaning there's a risk that I might get infected with body fluids. Automatically, that becomes a moment where that health worker must, even before putting on that gloves, then perform hand hygiene. Then immediately a health worker has finished whatever procedure that it is that has warranted the use of the hand gloves. The health worker will then automatically know that this then means also that there's a risk of exposure to body fluids. That is another moment for hand hygiene. So that complementary and use of gloves does not replace hand hygiene in healthcare.
Good enough, good enough. But let me ask you, okay, so this hand hygiene is actually more focused on healthcare professionals in hospitals. But sometimes people find themselves as caregivers in the home, maybe as directed by the doctor. Should they also follow these rules, maybe with their relatives? For example, like in COVID-19.
Definitely. Really, hand hygiene is the cornerstone of preventing infection, whether it is in healthcare or whether it is at home or in community, anywhere. Even in preventing it, not only for healthcare-associated infection, as a people, we must make sure that hand hygiene becomes what we do as a way of life. Then, even when one sees oneself in the position of a caregiver at home to somebody who is ill, standard precautions, as we know it, must also be there. For instance, if your child vomits or your child is stooling, you also must automatically think about, how am I going to get in contact with these body fluids coming out, even if it's from a child, even if it's from my child, or even if it's from my relation. It then means that the person will also think about how to make the hands safe before taking care, maybe feeding the person, and also how do I protect myself, my hands and my body from getting in contact with this body fluid that has come out of my relation who I'm taking care of. So it's not necessarily that one thing appertains when you're in healthcare and is different when you're paying attention to somebody who is unwell at home. But as a people, we must make sure that hand hygiene becomes a way of life, even in social settings.
Okay, it's obvious that hand hygiene is like the pathway to prevention of a lot of diseases. But are there any rules, if ignored, that will make nonsense or undermine the cleanest of hands?
Yes. I've said it that hand hygiene happens, and now I speak for healthcare, hand hygiene happens within that package of standard precautions. As a healthcare worker, each time you interact with a patient, in your mind will always be running, so how do I make sure that this interaction is safe for me, safe for the patient, safe for other healthcare workers who I will encounter, to make sure that I break what we call breaking the chain of infection, to make sure that infection is not transmitted from one person to the other. That then means that hand hygiene must take place in the context of standard precautions, meaning at all those 5 moments, I must do hand hygiene. But we know that as we interact in healthcare, we generate what we call healthcare waste. I will then make sure that any waste that comes out of my interaction with this patient, I must pay attention to ensure that that waste is taken care of in the way that it meets the requirement. But segregate it right and make sure that from the point in which that waste is generated to the point of final disposal, that it is done in a safe manner. Because such poor waste handling can undermine whatever we have done in hand hygiene. Same for the appropriate use of personal protective equipment. You have mentioned the use of gloves. If a health worker does the best of hand hygiene, but then uses gloves in the wrong way. For instance, you see a lot of people who, when they put on gloves, use it for every other thing. Sometimes even along the corridors of health facilities, you see health workers walking around with gloves. It will undermine whatever effort others are making to ensure that hand hygiene is done optimally. So nothing is done in isolation. And that is why we also pay attention to providing support for health workers, understanding that in the day-to-day operations and in the pressure as health workers, they cannot do it alone. So we promote the presence of what we call IPC programs in health facilities manned by competent people who work as teams to support their colleagues to get hand hygiene and other IPC practices right.
Can patients help health professionals prevent infection, keep the protocol of infection prevention and control at the point of care? Does the patient have any responsibility at all?
Definitely. The relationship, it's a contract. It is a relationship of trust that a patient has with the health worker. And there's just that ultimate goal that the patient gets well, the health worker feels fulfilled, that he or she has done a great job. So everybody has a part to play. Often health workers might be under pressure as they do their work, and that is where an informed and empowered patient becomes very relevant. As a patient, you can support your health worker by prompting your health worker. If you feel this is a moment where I believe a health worker should do hand hygiene, you can draw attention of the health worker to that. Also, patient support groups can also come together to make sure that the health facilities even have the resources that they require for hand hygiene. So definitely, patients can help. And even patients and their own caregivers should also make sure that they also play their own parts in their own hygiene and also hand hygiene at the moments they themselves also need to do hand hygiene.
Tell us a bit more about these healthcare associated infections. What are they? What are the most common ones? And how do they get into the society?
I'm glad you asked this question, Mary, because what takes people to hospital, it is that they're ill. And if what is taking them to hospital makes them vulnerable, they even become at a higher risk. So healthcare-associated infections are those infections that are caused by germs that can pass on from one person to the other. And then if somebody goes to hospital for one thing and then gets an infection in the hospital that the patient did not have, and the patient was also not harboring it before he got to the hospital. So this as infection can be said to have just resulted from healthcare. So these are what we call healthcare-associated infections. And what it does is that the organisms that cause them often also are organisms that are resistant to antimicrobials, organisms that are resistant to antibiotics. So it makes it even more difficult to treat these infections. And because also that often these healthcare-associated infections are caused by breach of IPC practices, there's then the tendency that this infection then begins to move from one patient to the other. So it can result in outbreaks of infections that are then hard to treat, affecting multiple patients in the hospital. That is why we pay close attention to healthcare-associated infections. And also because the people who it undermines their care the most are vulnerable people, children, young babies in neonatal intensive care units. Imagine patients that are receiving cancer chemotherapy, whose immune system is down, and who we cannot afford to have infections undermine their care. Think about patients undergoing transplant. And one thing we celebrate in healthcare is that now we are able to do more complex surgeries. We are able to intervene in more intrusive ways. But all these advancements can all be undermined simply because a healthcare worker was not or failed to do hand hygiene at the moments that the health worker is expected to do hand hygiene.
Okay, Dr. Tochi, we'll go on a short break now. When we come back, we'll have more on that. Thank you so much for staying with us. Meet us at the other side of the break. Welcome back. It's Health Matters on Channels Television, and we are focusing on hand hygiene with Dr. Tochi Okoh. If you have questions on the topic, call 0808-054-2233. You can send me a message at CTV_Mary A or email with moalale@channelstv.com. So, Dr. Tochi, I know that this hand hygiene thing is really focusing on healthcare professionals, but like you said, it also applies to anybody who is going to be a caregiver in the home or in school or anywhere. So I'm just wondering, most doctors I see, in fact, probably all, have short nails. Should healthcare professionals all have short nails? Or is there a way to clean up those nails so that they don't transfer germs?
As a health worker who has interaction with patients, particularly if your interaction will involve those 5 critical moments where hand hygiene must be done, part of that hand hygiene begins with even the state of the nails of the health worker. So health workers who will be involved in those types of care where the 5 moments will be mandated should not carry long nails, because the nails do harbor these microorganisms, and it will be very difficult, nearly impossible, to do an effective hand hygiene with long nails or artificial nails. So it's part of the package of supporting health workers to make sure that they do, that achieve hand hygiene compliance, is also in the training and in the awareness and giving them the knowledge to understand that in healthcare, long nails cannot apply.
Okay. You've already told us a bit about how hand hygiene comes to bear in antimicrobial resistance. You saw the footage of somebody washing his hands under the tap. And I'm just wondering, should we change our taps to non-contact taps or minimal contact taps? And then also tell us what is the best method of drying the hands.
Thank you for that question, Mary. You see, in health facilities, it is very, very important that we position the support, including the infrastructure that is required for hand hygiene, in the real context where it should be. It is expected that every hospital, every health facility should have at least an individual, and depending on the size of the hospital and the complexity of care, should actually have teams of health workers with a couple of those individuals dedicated fully to infection prevention and control. That is what we call having an infection prevention and control program. And part of having an infection prevention and control program is you then have a team of people who are focused to looking at the best type of infrastructure, including hand hygiene infrastructure that your health facility has, and looking for a way and looking for ways to make sure that they're optimized for the most effective hand hygiene. And that is why I will stay clear from getting into specifics of the types of taps, because even no matter the current type of sinks or taps that the hospital has, a functional infection prevention and control program and a competent IPC team we would find a way to work with the health workers to make use of what is available in a way that is effective as they plan to optimize and get the best type of infrastructure.
Okay, so are there mechanisms in place to gauge the success or progress of hand hygiene campaigns, or maybe the decline of hand hygiene campaigns, how effective they've been? For example, what was it like last year? Is it better this year? Do you have that kind of measurement mechanism?
Yes. Recall that the whole essence of the campaign, the whole essence of everything we do, trying to raise awareness among healthcare workers, and the training, the capacity building, is to bring concrete change on the ground. The whole essence is to make sure that at those moments where a healthcare worker needs to do hand hygiene, such a healthcare worker is able to then do it at those 5 moments. So, as part of the things we do as a national IPC program is to build the capacity of healthcare workers, particularly the infection prevention and control teams in the hospitals, to have a pool of what we call hand hygiene auditors. Because measuring hand hygiene compliance is the whole barometer we use in checking if there's an improvement. So we do what we call hand hygiene compliance tracking and monitoring, with the mindset that it will be continuous improvement where we are tracking to see if we are making progress. And it is when we see that we are making progress in that regard, that will be, even if it's an indirect measure, of checking if all the effort we are making to raise awareness for hand hygiene is happening. So yes, there's a measure for how we track real change on the ground. We also have a way where we follow up and track how much difference the hand hygiene is making, whether people are getting more and more aware. And as I speak now, a lot of states, a lot of hospitals in Nigeria have joined the Orange Network, where they continue to send to us the national IPC program, the progress they're making in what we call putting in place multimodal hand hygiene improvement practices in their health facility. And the whole essence is that we will all be pulling together to make hand hygiene compliance easier for healthcare workers.
So we are making progress. How much progress, or should I say, how much disease can be prevented with good hand hygiene practices if we get it right?
A lot. You can prevent a lot. You just have to look at what is costing us as a nation in terms of mortality, what is costing us in terms of GDP lost to healthcare-associated infection, what is costing us in terms of manpower loss. Each time a patient has to stay longer in a hospital because such a patient has acquired healthcare-associated infection. But I'll now speak specifically as a national IPC program that is working hard to support states in the country and health facilities across the country to build strong IPC programs that are also prioritizing hand hygiene compliance. And Mary, I am very happy to tell you today that currently every state in Nigeria now has somebody designated as their state infection prevention and control focal point. That is massive. Because what this then means is that in every state in Nigeria, you have somebody who is now focusing on strengthening infection prevention and control in hospitals and all kinds of health facilities in the state, including the private ones. They may be starting small, but are headed in the right direction. We also, at the National IPC program, offering them the support they require. We have plans now to take them through professional infection prevention and control training, a collaborative effort we are doing with the Center for Infection Control and Patient Safety of the College of Medicine, where we intend to build the capacity of these state IPC focal persons to become competent as IPC professionals. And also we're extending the same to many public hospitals in the country. So from where we sit, we are making progress, and we are quite determined to take it one step at a time, but to continuously make that value proposition to the Nigerian that will make every effort to make the encounter with the health system a clean and a safe one.
I wish you could extend that to companies as well. It would be lovely to learn some of these hand hygiene techniques and principles. But thank you so much, Dr. Okwo, for coming on the show. It's been wonderful having you as usual. And we would love to have you back again.
Thank you, Mary. Always a pleasure.
Thank you for being with us on the show and participating from your end, whatever that end is, a TV, a computer, a tab. Have a wonderful day. I am Mary Alale Yusuf.